to our series focusing on working with runners. And in this episode, we're going to look at a really lovely hip stretch for the anterior hip as such, because it's going to be quite a sticky area to work with at times. And in this episode, we're going to actually look at using a muscle energy technique that incorporates an assessment tool, which is the Modified Thomas test. Modified Thomas test will look at potentially as one of many assessment tools that you need to use. We'll look at restriction around the anterior hip. So essentially, or traditionally, it looks at restriction in the rectus femoris, the vastices, and maybe even some lateral hip restriction as well, depending on, when we get him into position, what his leg is doing and what it's telling us. Now, again, as a full disclaimer, we have obviously been through a full medical history and intake with Paul to rule out any red flags, and this is purely now we're using this as a technique to demonstrate a really useful hip stretch for your runners. Okay, first and foremost, though, is to start off with is how to get your client safely into this position. So again, another caveat to this is it's not necessarily a technique that I would use with every demographic. Your client does need to have some degree of body awareness about what they're doing here. Okay, Paul, if you wouldn't mind taking a stand for me. And essentially what we're going to do is that your head's going to end up in a diagonal position. So and the reason why I'm saying this to Paul is because his body's going to go diagonally across the bed, which is why it's called a modified Thomas test. Traditionally, Thomas test is done at the end of the bed, but for safety purposes, I favor this one a lot more. Okay, so you're going to end up lying across the bed here, and you're going to hold your right knee with you, and your left leg is going to dangle off the bed for me here. So take a seat down. I'm going to help you safely get into that position. So you're going to take that right knee for me. That's it. Good. And then lay back. I've got you there. Beautiful. And then right away, we make sure that we towel our client. Good. If necessary, there we are. Good. And then what we're looking at with here, now that Paul's in that position, the reason why we're getting him to hold onto this leg is going to give him some stability as well. But we're looking at now what this Modified Thomas test is telling us. And for me, he's got a little bit of restriction in that anterior hip. And again, this test doesn't tell us the full picture, but it's giving us a snippet of what's going on. So I'm going to use this muscle energy technique called post-isometric relaxation to work with this anterior hip. And we've also touched upon this technique in another video as well. So all I need to do here now with Paul is set myself up. So Paul, when I ask you to, you're going to end up pushing your knee or your thigh into my hand, which is going to activate and isometrically contract this anterior hip and the muscles in that area. So Paul, just gently, would you mind just pushing that knee up into my hand? And it's just a simple pressure. It's nothing too heavy. And you're going to hold it for 10 seconds, essentially. And then once those 10 seconds are up, Paul, take a deep breath in. And as you breathe out, let that contraction go. And I'm going to gently send his leg down into the next barrier. You hold it in this next area for 10 seconds. And in that next barrier, the barrier means it's a really subtle movement to go to that new position where it feels that there's just a little bit of a hint of a stretch happening. You hold it in this new position for 10 seconds, and once those 10 seconds are up, again, I'm going to ask him to do the same thing. We're going to go through the sequence again. So Paul, would you mind just pushing that knee back up into my hand again? That's it. No discomfort? No. Brilliant. Holding it again for 10 seconds. As you can see as well, as we're pushing that leg down even more, having his opposing leg up, let that go. And I'm going to push it down to the next barrier. Having the opposing leg, or the opposite leg, sorry, being held means he's also protecting his lower back here as well. Good. We're in that new barrier. We're holding it for 10 seconds. And again, one more. Push up into me. There we go. That's it. And again, that contraction is minimal. It's just enough to fire up the muscles and that isometric contraction. Good. Deep breath in. Let that go. And then for me, this is probably about where I'm going to get him to. This is all I need to go. It's a really nice stretch all the way through that anterior hip and through that thigh. So we're going to hold it there for 20 seconds in this last position. And once that is finished, all I'm going to do to reassess essentially is look at where his leg now wants to hang or where it feels comfortable to be. And for me, it's a nicer improvement than where we started at the beginning. So then once you've finished the MET, it's just as important to get your client safely off the bed as it was to get them on the bed. So in order to do that, I just need to make sure that I'm very clear with my instructions with Paul. So I am going to remove any surplus material that I don't need at this point. Good. All right, Paul, and when you're ready, actually, I'm just going to get you to take a seat up, and your foot can probably find the floor here. And I'm going to also help your client, if they need to, help them up from the bed as well.